Good afternoon, all of you. Today I'm going to start a new topic on case history, how to take your ophthalmic case history for the top course of Clinical Optometry Unit 1. So today, basically, as you all know, in optometry, in the field of optometry, case history history taking is one of the most important thing. And so today's learning outcome will be what will be, state what taking a history is and why it is important. Describe the things you need to ask about a person's eye and their vision. And describe the things you need to ask about a person's general health, lifestyle. Perform a case history. Use good communication skills when taking a case history. So all these things first before going through. First of all thing we have to understand why this case history we need to take the case history. As a clinical profession or as a clinician, we have to deal with patients. Okay. And to deal with patients and to deal with human beings, we first need to gather information which are very much related and which can be used for further diagnosis and for the treatment and for evaluation, clinical evaluation, for diagnosis and for treatment. Most important thing is the history taking, and for history taking we need to take some more information. Okay, so only information will not help. It will we will have in this lecture I will go through one by one of each symptoms, signs, treatment, what are the things we will do one by one, and then to so that we can come to know about the history taking, proper history of a patient, so that it will be easy for us to do a proper diagnosis, clinical evaluation, and also for proper treatment. The first of all thing what we need to understand from the patients, as you all know, whatever we see from the patient's point of view, it is normally known as signs. But what the patients tell us about all their problems is normally known as symptoms. So ask the patient about their eyes and how well they see. Next is the evaluation. Before going into the evaluation, we need to take a proper information. And for that, you also need to take the visual acuity, how much the patient can see. Then we will look carefully at their eyes. That is the signs. A person's, so what is case history? Okay. So a person comes to see you with a problem about their eyes or their health. Now, whenever you are a clinician, whenever somebody is coming to you, he or she is definitely having a problem with their eyes or their health. You will need to ask question to find out what the problem is. The question you ask may be about their eyes, general health, and their lifestyle. These questions and answers the person provides you with makeup of the case history. So the question which you will ask and the answer which the patient will give will tell you about the case history. So at the start of the eye examination, it can continue throughout the examination, especially if your testing reveals new information. So at the start of the eye examination, you need to have a conversation with the patient. Okay. And this conversation will give you a lot of information which will tell you what is important, what are the important problems the patient is facing, what are the patient's problem. So in our case history, we will have lot of subdivisions like chief complaint, past history, present history. So all these things we need to ask, because all these things will tell us where the problem is, why the problem is, what is the problem with the patient, and how to deal with these problems. And these can only be done when we have a proper conversation with the patients. Okay, so and for this you need to take the case history very seriously. Only after taking the case history, then only we will able to answer or deal the patient properly. Means we can do the clinical examinations, and also we can do the evaluations, and also we can do the proper channelization of the patient. Okay, so we can refer the patient properly, we can manage the patient properly, we can treat the patient properly. And remember, case history, it looks, most of the patients, doctors which I have seen, or most of the optometrists what I have seen, they take very 2 minutes for taking case history, because there is a huge line of patients, queue of patients waiting for you to see. So what you do is you just take 2 minutes and do write, fill all the points and leave. But in doing that, you may lose a lot of important information. And so that you don't lose the information, you need to understand where the problem is. So you need to ask a lot of questions, you need to come up with a lot of good ideas, and with that answer you can come ask more question to the patient, so that the patient can answer. And patient also feels satisfied when you talk to the patients for a longer period of time. And as a result, you get a lot of information by which you can treat the patient properly, and you can answer their queries properly. The only time when we do to take the case history first is when there is an eye emergency. So only time when we can do the skip the case history is when there is an emergency. Other than that, you need to take the history properly before going for any evaluation. So why do we take a case history? A case history helps you to find out the problem the person is presenting with, if the eye problem is getting better or worse, which tests needs to be performed, which action needs to be performed. I already told you. Now, what is the indication of case history? Basically, in this slide, what we are talking about is that the problem. Suppose the patient has come to you. He has not come to you for fun. He has come to with a specific problem. First of all, think the basic problem you will able to know when you take a proper case history, and allied problem like a patient has come to you with itching of the eyes. Suppose let's take an example. So main problem may not be the itching of the eyes because something has gone wrong with the general health. So you need to find out what is the wrong with the general health. Maybe the patient is using some medicine for a longer period of time, and because of that side effect, patient is having a itching. Maybe the patient is using some drops which is not suiting to him, which is having an allergy, and because of that, so you need to take all these informations together. Until and unless you don't take all these informations together, you will not be able to be a good optometrist. At the same point of time, you will not be able to understand what the patient is saying, and also you cannot deal with the patient properly. So first and foremost, your history taking is very important, and it also tells us which way we will go, because there are, as a clinicians, you will learn lot of tests, lot of instruments you will learn. For a single patient, you cannot use all and each and every test you cannot use. You have to be specific which test to use for which patient, which test to use for which patient you will not use this test. So for finding out all these things, you need to be specific about which test we will do, which test we will not do, which test you prefer over which test. Okay, so this case history actually makes half of your work easy. Only when you do these things properly, then only you can go for a proper clinical evaluation. You may then need to treat the problem. Then you need to treat the problem. You can refer the person, talk to the person or the community about the spread of the eye disease and provide education. You can also counsel the patient. Okay, counseling is very important. So often a case history is more helpful in diagnosing a person's eye problem than test than do you that you do. So case history is more helpful in our first year, second year students. You are all second year students. You can learn a lot of things from the case history, and you will be sent to the hospital from maybe the end of this semester, so that you can able to go to the hospitals and you will take the case history properly, and we will teach you in practical sessions how to take a good case history, because this case history will tell us where the problem is and how to solve the problem. Now, as I was telling you in before, now we will go into the detail of what are the components of the case history. Till now, we were talking about why case history was important, what are the importance of case history, why we should take a case history, all these things. Now we have to talk about what are the components of the case history. Now, first of all is the chief complaint. Now, chief complaint tells us that whether the patient is having a problem, or the patient, what main complaint the patient, because of which the patient is coming. Suppose the patient is coming with an eye pain, so your chief complaint is the eye pain. Suppose the patient is coming with a bloody vision, so the chief complaint is bloody vision. Or the patient is coming with a pain in the eyes, so the chief complaint is the pain in the eyes. So you have to first find out what is the main complaint of the patient. If you find out what is the main complaint of the patient, half of your battle is won. And you have to ask about the eye health, what is the main eye health problem of the patient. Then you have to ask about the eye history, means whether the patient has any trauma, or whether the patient had any problem with the eyes, or patient was having any watering of the eyes, or may patient was having some other problem, because of this problem was happening. So all these things you have to correlate one by one another. So until and unless you know the main complaint why the patient is coming, you cannot go on the beyond. And then the general health, maybe the patient is suffering, all these things is happening because of the diabetes, because the patient is suffering from diabetes for last 20 years. So you need to ask those questions. Until and unless you don't ask this question, it will not be clear for the patient to answer. And also you need to talk to patient freely, so that the patient tells you all the things. So if you are too professional, or if you are not very casual, it will not happen. So you have to maintain a balance where patient will share all the important information will be. with you, and that information will help you in your clinical diagnosis, in your clinical treatment, in your clinical management. And the last one is the medical and the family history. So the medical and the family history will tell you what is the importance of the medical fraternity and the family history. So medical, what are the medicines patients are having, what are the things, what are the informations medicines the patient is taking, and the family history will tell you what are the family problems the patient is having. Suppose patient's mother has some problem, and from that eye problem the patient is getting that eye problem. Okay, so family history is very important. As medical history is very important, if patient is having any medical previous medical records, from that medical records the patient is having a problem, the family history is equally important, because with the family history you can crack lot of cases of the patients. Okay, now chief complaint, as I was telling you, chief complaint is the main reason the person comes to you. Maybe the patient cannot see problem because of the spectacle, as you can see in this picture, or patient is having a dimness of the vision, or the patient uh, having pain in the eyes, or the patient is having a uh, get eyes get red often. So what is the main problem patient is having? This will give you a lot of information by which you can ask other information, and which will tell you what are the other problems is, and you can go ahead with it. So always investigate the chief complaint during the eye examination. So first of all thing, whenever the patient is telling you the chief complaint, whenever you are doing an eye examination, so your eye examination should always indicate what is the main complaint of the patient, not what you can see. Maybe you can see a lot of things, but you can see the first of all the main symptoms or the main complaint of the patient is itching of the eyes. So you have to treat accordingly first the itching of the eyes, and then you have to look the underlying cause. So your investigation and your treatment should always answer the chief complaint. Discuss your findings at the end of the examination. Don't talk to the patient before only. Don't don't jump to conclusions. First, do all your examination. First, listen to what the patient is saying. First, understand the chief complaint and other problem. Then start discussing with the patient. Please try to do something about the chief complaint. So always with the chief complaint, you try to do something which will help you to do. Otherwise, you will have problem. For example, a woman's chief complaint might be that she cannot see close up to do her sewing. So we should try to provide a spectacles that we give her good near vision. Suppose you know what is this case? This is a pure case of presbyopia. So you know from this example, from this complaint, you can understand the patient is already having a presbyopia. So although the patient, you can find out with your examination that patient is having a distance vision problem. Fine, no problem. But at the same point of time, you have to also understand with the distance vision, you also have to find out the near vision also. When you are doing a distance visual acuity, you find the patient visual acuity is not 6 by 6, it is 6 by 24. You have to do the near distance correction. At the same point of time, you have to correct the near also. So distance and near both will give a good visual acuity for the near. Only if you check the near, it will not do. So you have to understand the chief complaint and you have to treat properly. Now asking for details. When did the problem first start? So what are the question normally we ask? We ask when did this first start? Did it happen gradually or suddenly? So whether this problem started gradually or suddenly. So we have to understand whether this problem is suddenly it's happening or it is gradually it is happening. Is it getting better or worse? Is it there all of the time or some only sometimes? Is it there throughout the day or for sometimes? How long has it been happening? Okay, is it with one eye or both eyes? So whether it is happening with the both eyes or whether it is happening with the one eye. So all these things you have to ask the patient. Until and unless you don't ask this patient, you will not be able to. Has your vision changed? So whether your vision is changed or not, that also you have to ask. That also you will get an information whether the patient's vision is changed because of the problem or no. So asking for details, as I told you before, how do your eyes feel? For example, if you feel irritated, itchy or sore, do you have pain? Or if so, what is it like? Dull or sharp? What is the pain? Do you have any other symptoms where you can get the pain? So all these things you need to ask. Okay. So whether you have irritation, that is your main problem, or whether the pain is main problem, where is the pain, in the upper lid or the lower lid or inside the eyes or outside the eyes. So all these things you have to ask. And do you have any other symptoms when you get the pain? So when you get the pain, so do you have any other symptoms with the pain? Because only having the pain is not a problem, but with the pain, whether you are having other problems also or not. Asking for details. Have you noticed if your eyes look different, whether your eyes look red or swollen? That is also very important. Okay. So have you done anything about the problem, seen anyone else tried or anything? Suppose the patient has used some medicine from unwanted source. Okay, from where he don't know. He just buy medicine from and he has used it and the symptoms have increased. So you need to find out that. Does anyone else you know have the same problem? Does the patient does you know someone who is also having the same problem, and you have seen that and you have used the same medicine? Is there anything more you can tell me about this problem? So if you know any other person who is having the same problem, so all these things you have to find out. In the eye health, we have to ask for the vision, flashes, floaters, eye health, and visual needs. So first of all thing we have to find out in our vision. In the eye health, we need to find the vision. What is the vision of the patients? Which is the main important thing. Next, whether the vision is clear, whether the vision is blurry, or whether the vision is absolutely clear, but you cannot identify certain things, whether there are flashes and floaters. Okay, whether the flashes are there or floaters are there, whether the eye health is good or bad, whether your visual needs, suppose you do a lot of computer. Currently, I'm using an app to record this visual section. So whether I can see the camera properly or not. So that is my main visual needs. Maybe some patients, as you can see in the example, some patients main work is sewing. So whether he can see the thread and the sewing machine properly or not. Some patients may be writing, whether they can write the things properly or not. So all these things are very much important. If patients can see and do all these things, then only his visual need is required and is finished. Otherwise, it is not done properly. So you have to redo the things properly. So vision, to find out how well a person sees, you should ask, how is your vision when you look far away? How is your vision when you read books or look at things up close? So I just now I gave you an example. So you have to ask whether in vision, normally we ask whenever we are taking an history, we only ask for the distance vision. We normally ask whether you are having any vision problem. Patient say yes, I'm having problem. You write it down and you leave it. Most of the students do that, but we don't ask whether the patient is having problem in the near thing or not. Only distance things will not work, but whether the patient is also looking at the near thing or the distance things, where if they are seeing if the balance is okay or not. If the patient is having a problem with the distance, then write it down. If the patient is having a problem with the near thing, write it down. So then only you can do the treatment properly. Normally another other than vision, most important problem with the symptoms with the patients is flashes and floaters. Now what are flashes and floaters? As you can see in the picture, like thundering of the eyes in our eyes, sometimes it happens. It is one of the common cause of retinal problem. Okay, so what is retinal problem, we will learn in the another semester or in the another unit. That is not part, and in this semester also you don't require it, so don't worry about it. But you can see some flashing of lights like that, and these flashes and sometimes floaters, black particles or black like insects or mosquito things goes inside in front of your eyes all the time. If these things happens, then you need to check the retinal part or the posterior segment of the problem. But you need to ask this question. Most of the clinician misses this point, or maybe this is the main complaint of the patient. Patient is not complaining of the visual acuity. Patient is absolutely fine with the visual acuity, don't have any problem with the visual acuity. But what the patient is having a problem is with the flashes of light. Patient is always telling that there is a flashes of light, there are black particles in front of the eyes which is always moving here and there. Then then you would have to report this, because when you are doing the investigation, this should be your main, and you know where to investigate. I already told you, right? So do you ever see flashes of light? When do you see them? Have they changed in size? Are you seeing more floaters than before? So all these things you have to understand. Did you have any injury to your eye or to your face? All these things you have to ask, because sometimes the injury of the eyes and all can also cause all these problems, because it can help the not only damage the cornea but also the retina. So you need to ask all these questions properly so that you get. In the overall eye health, you need to ask question. You might ask a person about their eye health, include Do you have red and sore itchy eyes? Do you get headaches? So all these things you need to ask the patient. Okay. So this information will tell you a lot of things whether the patient's eye health is good or not. So whether the patient's eye is red, sore or itchy, do the patient gets headache? So all these things you have to ask the patient properly. In the eye health visual needs, to find out what the person's visual needs are, you should ask what they do, like computer using, drawing, driving, their hobbies, sewing. So all these things are required, not only the main work. Whenever we are asking about the visual needs, normally what we ask is we only ask the patient about their professional work, like whether they are using the writing and the computer, but we normally forget the hobbies. But hobbies is an important part, and we need to understand that what are the main work of the hobbies. So if we can understand what are the main uh, visual needs, whether the patient is retired and he only pursuing the hobbies, or the patient is so active in his professional life that he don't have time for his hobbies, pursuing his hobbies. So all these things we need to find out. Until and unless we don't find out, we will not be able to treat. And we need to ask this question. In the eye history, very important thing, we need to ask about the last eye test or eye examinations done. Because we know as an optometrist, yearly two times eye examination, we always recommend to the patient. So when the eye examination is done, 1 year ago, 2 year ago, especially if the patient is having any clinical conditions like glaucoma or retinal problem, treatment is going. Maybe the patient has not seen his eyes for last 2 years, okay, which is not recommended. So from that only, maybe the symptoms which the patient is complaining, that is related to that, because many things have happened in the eyes, patient has not reported, and the patient is coming after 2 years. So maybe treatment was required and it was not done. Okay, so last eye examination is very much important, whether with the spectacles, whether patient is happy or not. Because a lot of patients we have seen in our OPD and clinic, that we have prescribed the spectacles, patient is wearing the spectacles, but at the same point of time, patient is not using the spectacles properly. So if these things happen, please report these cases immediately, because not using or the alignment is not good. That's why maybe the patient has not liked his frame color or the glasses style, and that is why he is not using. So these type of cases can be addressed in a different way. Okay, headaches. Again, headaches can be of many kinds. Like headache can be because of the migraine. Headache can also cause because of the eye problem. So if there is any underlying eye disease, that you need to find out by which the patient is having a headache or not. And last but not the least is the eye history. So eye history is also important, whether patient has having any eye trauma or eye problem. All these things you need to find out. Last eye test, as I told you, have you ever had any eye examination or eye test? If yes, how long had it been your last eye test? As I told you, if the patient didn't have a eye examination and he is having a clinical condition, we need to record that because it's very important. Spectacles, do you have spectacles or have you ever worn spectacles before? If the person has had spectacles and he is not using his spectacles, then it's important to note, because we need to find out and what tasks a patient is doing with the spectacle. How old are the spectacles? Maybe the spectacles is too old and it has got a lot of scratches and it is not giving the proper optical quality. So for that you have to find out how well do you see with the spectacles. Are you happy with your spectacles? That we have to find out. Headache. Do you get headache or eye strain? When do the headaches or the eye strain start? How long does it last? So, as I told you, eye strain and headaches are the most common things in our eye problem. And we need to find out why this headache is happening, why this eye strain is happening, and what is the main reason. So, if we can find out what is the main reason and what are the reasons of the eye headache and the eye ache, we can solve half of the problem. So, we need to find out what is the main problem of the headache. Okay, because headache can be caused because of migraine, headache can cause because of the glaucoma, headache can cause because of the retinal problems. Multiple reason headache can happen, but if you can ask the position of the headache and other problem, easily you can understand where the problem is, from where the you can actually guess, and then you can start your examinations properly. Show me where your head is spinning. So the location is very important. Are the headaches worse in the morning or the afternoon? So the timing of the headache is very important. Does the headache go away when you had a sleep? So after sleeping, do you have a the headache goes or the headache is there? How bad is the headache? with a scale, means out of 1 to 5, what is the scale? Do you have any symptoms with the headache, vomiting, and flashes of light? As you can see, it is one of the main causes of glaucoma. The headache with the symptoms of nausea. Okay, so you have to ask this question. You have to go it into the detail. Until and unless you don't get into the detail, you will not get the proper information which you require. So, eye history, do you have any eye conditions or disease like cataract, trachoma, or glaucoma before you have been diagnosed with this? So, if it is there, then you need to ask the reports for it. And until and unless you are not asking for the reports, you will not be able to know what is the problem with the patient. Have you ever had any eye injuries or infection? Okay, maybe patient has got an eye trauma or eye injury or infection, and because of that problem, now the problem has started. So you need to take an complete history of that also. Okay, so have you ever had any eye surgery on your eyes? Maybe the patient has a cataract surgery before. Now the patient vision was okay. Now there is some problem. Maybe there is a PCO. Okay, so you need to find out posterior capsular opacity. So if there is maybe a new retinal problem which has come up after treatment, it was fine. Maybe some retinal surgery they have done, vitrectomy or diabetic retinopathy surgery has been done. Advanced cases, it was fine for a few years. Now things have started changing and patient is having a problem. So you need to ask this question very carefully. Okay, have you ever used any eye drops or medication for your eyes? So have you used any eye drops, or you have used without prescription, or from the medicine shop, or you from different places, have you used any eye drops? So you need to find out properly. Asking about general health of a person can help us find out what is wrong with their eyes. So general health is very much important, as I told you before also, because without the general health, you cannot find out where the problem is, how the problem is, from where the problem is coming. So until and unless you don't find out where the problem, what is the general health problem, you will not be. As I told you just now, I was talking about diabetic retinopathy. Diabetic retinopathy occurs after 20 years of diabetes. Glaucoma can happen because of the family history. Okay, hypertensive retinopathy happens because of the hypertension. So you can, from my words also, only you can find out from this how much it is related with your general health and with the medical history. So you need to take that history very properly. Okay, so you don't miss those things. Okay, many eye problems develop due to eye injuries or eye treatment as well as disease in the body other parts. So you need to find out which parts the patient is having a problem. Like from arthritis, you can have uveitis. So you need to check whether the patient is having joint pain or not. So you need to ask this question. If the patient is having a joint pain and with the redness of eye, your brain will go directly towards the uveitis and you will check that first. So you need to note it down in the history. Until and unless you don't note it down, you will not be able to treat accordingly. So in general health, what are the common questions we ask? How is your general health? Are you seeing a doctor for anything? Are you using any medications? Do you have any allergies? Do you have any blood pressure, diabetes, or abnormal blood pressure? So and are you pregnant? Because of the pregnancy also, there can be a lot of general health issues, and from that, eye problems can also be there. Next important, as I told you, with the example of glaucoma, that family history is very important because there are a lot of history which comes from mother and father. So same eye problem are more common in some families than others. So you need to ask about the problem of the mother and father. It is important to know about eye problems in a person's family history. Family history, does anyone in your, so what are the questions we ask over here? Does anybody in your family have health problems, general health related problems, or eye health related problems? You need to ask. Does anybody in your family have eye problems? Record these details. Communication skills. Now, after taking, although we have not mentioned a few things, like I will tell you, like allergies, we need to ask a lot of things. Okay, apart from surgical history, allergy is very important. Allergy means not food allergy, but allergy is your drug allergy. That is very important. Some patients has got problem with their penicillin drug allergy. So you need to write it on the top with red that this patient is having a penicillin allergy with penicillin. So when a doctor is prescribing a medicines, he will not give drugs which is required with penicillin, or the patient is having a uh, with psychopentalate. So whichever drug the patient is having an allergy, you need to write it on the top of the case history with red pen so that the doctor to grab the attention of the doctor, or the to grab the attention of the person who is prescribing those medicines, because only with grabbing those attentions only we will be able to understand where the problem is and how the problem is happening, so that we can treat the patient properly. So after all these things, most important is your communication skills. Okay, while you are doing this marathon work, you need to have very good communication skills with the patients. Important to get correct and helpful information from a person. So until and unless you have good communication skills, you will not be able to get a correct and helpful information from person. So the person you care about them and their eyes. Make the patient comfortable, make the patient understand that you can see that you are very much aware and you are very much confident and you are also very helpful, and you are very really helpful to see what the problem with the patient's eyes. So there you take a good history. Greet the person and introduce yourself in a friendly way. Whenever a person is coming to you, greet the patient friendly in a person and introduce yourself in a friendly way, so that the patients talk to you. Good morning, sir. How can you help you? Please tell us what is your problem. All these things will help the patient to help you to build a good rapport with the patient. And as a result, the patient will feel comfortable to disclose all the problems. See, there will be a lot of problem, confidential documents will be there which you have to ask, and so until and unless you don't have, if you are too rigid, the patient will not talk to you or reveal to you. Maybe the patient will reveal when you are doing the examinations. So it will be a problem. So you have to have a very good communication skills, and you have to talk to the patients in a friendly way, so that the patients reveal their problem very much, so that you are able to think. Show the persons where to sit and sit facing to them. So you should have direct eye contact with the patients. It's not that patient is looking somewhere, you are looking somewhere and you are asking question. So you should have the eye contact with them. Where the patient chair is, you show them, you sit in the doctor's chair and you ask the patient and write it down carefully. So there is no problem. Listen carefully to what the person tells you. Most of the clinician, we are so busy that we don't have time to listen. We write down, we ask question, we write down, we don't give time, and we just like a machine we write it down. This is very good bad. So what you have to do is you have to ask each and every point very carefully. Until and unless you don't ask, you don't note down each and every problem, it will be a big problem. So use the words a person will understand. Listen to the person carefully and note it down each and everything, then only you will able to get all the required information. Time, most important thing. Another thing is give time for patient to answer. Maybe patient will not answer properly. I have seen patient went to 5 or 6 doctors and the patient is not revealing, because the question was not asked properly. Where you have come, what is your problem, it's gone, patient is not responding. After evaluation, when you find something, when you are asking one by one, then the patient is taking out all the reports. Okay, so you have to give good timing to the patient, so that the patient answers is comfortable with you and answers all your queries. Then only you will able to evaluate the problem properly, then only you will able to answer all the questions and note down. Ask question in an organized and logical way. You have to ask the question in a much organized and a logical way. Then only you will able to note down all the informations properly. Otherwise, you will not be able to answer all the informations properly, so that it can be used in the clinical information. Open-ended question should be asked. Require the person to think about the question and describe what they think or how they feel. So questions like what, when, how, describe. You only don't ask the question and give the answer. It should not be a MCQ based, okay, or it should not be a scale based. Or you can use the scale in a different way, but most of the questions should be open-ended, so that the patient answers all the information properly. And when the patient is answering all the information properly, you take all the informations and you sum up all the informations and you make a good case history, so that it is used for the patient in a proper way. In that case, I have completed this module. But most important thing what I want to say is that you need to ask the patient, give time to the patient to answer all the question. Until and unless you don't answer the question properly, patient will not answer. Okay, that comes to the end of my lecture. Thank you so much for listening to my lecture. Thank you.